Welcome to This Week in Health IT Influence, where we discuss the influence of technology on health with the people who are making it happen. My name is Bill Russell, recovering healthcare CIO and creator of This Week in Health IT, a set of podcasts and videos dedicated to developing the next generation of health IT leaders. This podcast is sponsored by Health Lyrics. If you're looking for an executive coach, give us a call. Visit healthlyrics.com to schedule your free consultation. 2 new services just to make you aware of: This Week Health Insights for health IT individuals looking to propel your career forward, and This Week Health Staff Meeting for managers who are looking to introduce their team to new thinking from industry leaders to get the conversation started on the right foot. If you want to get to either of those, hit the website, thisweekhealth.com/subscribe, or click on the subscribe button on the top right-hand corner. That'll take you to the page and get signed up. Today, we're having another one of the short episodes around the Epic UGM, the user group meeting. I keep calling it a conference. It's a user group meeting from 2019. This is Dr. David Butler, who is a principal and chief digital officer for Calyx Partners, which is a physician-focused Epic consulting firm. He's been working with Epic for the better part of almost 20 years. And just really appreciate all the things he was doing on Twitter. And I thought, I'm going to reach out, get him on the show, and get his feedback. So here's the session with him already in progress. Well, today we're joined by another attendee of the Epic UGM 2019 conference, Dr. David Butler, Principal and Chief Digital Officer for Calyx Partners. Welcome, David. How's it going?
It's going well, thanks. Thanks for having me on, Bill.
So you're still on your way back from the conference, it sounds like.
On the way back from the conference, I've left all my bell bottoms and 79 gear there. Yep, got popped in my cassette tape, and I'm headed to the airport. That's me.
So for listeners who don't know, Calyx, you do a lot of consulting around the EHR, but your background is as a CMIO. For a lot of different companies, and you've done work at Cleveland Clinic, New York Health and Hospitals, Guthrie, UCI Health, and anything else I'm missing? This is going to be a short bio because we only have 20 minutes together. So
yeah, no problem. I think the biggest thing, I've been an Epic user, physician, for large healthcare clients. The largest being Sutter Health 3 years ago, vice president over there, Epic optimization program, and from there I left to start consulting with other Epic clients that needed assistance. So, yeah.
Well, that's awesome. So you were in attendance. So, what jumped out at you? What were some of the key themes that you're walking away from the conference with?
The key themes I think are they're pretty. I've been coming to Epic's users group meeting for 17 years now. And so I think Judy and Carl and the leadership there, they're still staying spot on as far as the way they build the software around the patient. And this was their 40-year anniversary, and they had just had a chance to say, they highlighted over the 40 years what they've done to build the software around the patient and how much they've invested in R&D, research and development. And for a lot of Epic clients, if you're an Epic client and you know what that means and all the time that they spend and all of that, if you're not, sometimes it's a bit cryptic as far as understanding what is and how does that all work. It's like kind of like Mac, cult for the Mac kind of. So that's what I think about it. So yeah. And they also, every year also they once again she emphasized and everyone a lot of this was about using what you bought. It's like we'll purchase these large big investments and a lot of clients may not be aware of the functionality that they purchased. And to do that, and also they talked about some resources that Epic continues to invest in as far as having that client speak to one another, put together papers, documents on how they do certain things, or there's some sepsis to heart failure to population management, and put those papers, use them, and they're available internally on something called the Epic Users Web that's available to all clients. So they were just a lot of it was reiterating some things that clients should be using or that are available to them that they may not be aware of, and these are comes with the car,
Yep. And so some of the patient-centered things that I'm picking up on are, Epic's Happy Together unified patient-centered view of MyChart. You had MyChart estimates. You had Care Everywhere, patient-initiated sharing of the record. Yeah, I'm just throwing out some of the things. Were there some other things that they did that you heard that you were like, yeah, they're really making movement around this, around patient-centered, around helping health systems to be more patient-centered?
Yeah, I think you totally rattle off the big ones, and those are a lot of sometimes I call epicism, some of those words, and so non-epic clients may not know what that mean, or even patients that may be listening. So yeah, putting the care into the patient's hand is what it's about, and that's where it's been about. And so where if you have 3 different records, like for example, I moved over 4 states, me and my family, for various jobs. I have about 5 different MyChart accounts now. One click, I can now see one patient portal and all my data. And if I go to a doctor somewhere and that doctor does not have Epic, it could be a medical care, it could be a urgent care, I can now with Share Everywhere, I can give them a code. They'll log into a website, not a patient portal. They can log into a website, put in that code, because I've given them access to my notes or whatever they need, if they need that. So I think that it has been the biggest, one of the bigger innovations that I've seen in over like 10 years dealing with Epic, as far as on the patient side, and without much build or effort on the client side. So.
Yeah, I mean that's pretty exciting stuff to be able to literally. I could leave California, go to Florida, go to an Epic shop, or actually go to anywhere. Quite frankly,
anywhere.
Doesn't have to be an Epic shop, and give them access. Patient-initiated care everywhere just means, that it aggregates that data and makes it available wherever I'm receiving care, which is pretty exciting stuff.
Via website. That's what's crazy, right? Via web portal. You don't have to log in Citrix and all this other crazy stuff that we're so used to in healthcare. So yeah.
you know how that goes. For those people not able to attend, I mean, what's the 1 or 2 things that you would say, hey, you should really look into this, that, I don't know, maybe Cosmos, or I don't know what they talked about, but actually I have a good idea of what they talk. I've read a lot of articles.
Yeah. But no, it's fine. Yeah.
So what are those 1 or 2 things?
I think the one thing that was really impressive was Cosmos, and Cosmos is this. You could just imagine clients that say, want to do research, all this data that's in various Epic all over. Epic is about, I guess, 60 to 70% of bedded patients. Some data lives in Epic at some point in time or something like that. I don't know the quite statistics, but if you can imagine driving through those databases, trying to find research or like cases. Sometimes you get an N sample of 2 if you're within one organization, but if you can now scour Cosmos to say, okay, for all patients that I treated for sarcoid with this medicine first line, this was where it ended up. Or for this type of medicine that they gave a really good example. Phil Lindeman, who's over the analytics, was really sharp. He gave an example of like this, how you could look at Cosmos and ask a question to say, does this medicine in 10-year timeline, what is the chance of it leading to, say, dementia versus this medicine? So those are really difficult type things to do today, and research type studies, a longitudinal study. So that was really powerful. And I think that's pretty much, I feel like, Judy's moonshot, which is a great one to have. And so Cosmos is huge, but also I think for clients that are not even there, that's all future stuff. I think the biggest thing that I see over and over, and that even, is that clients have bought a Lexus, but they keep taking it to Jiffy Lube, and I think Epic is trying to say, stop taking it to Jiffy Lube. We're Lexus, not Lexus, the analogy, meaning you already paid for this, you bought it, here it is, and stop innovating and start imitating, because a lot of your colleagues over here have already done it, built it, and in the system, and it's working, and they're putting points on the board, but you may not be aware of that. So they were bringing more awareness to things like the CEO handbook, where the CEOs can flip through, financial handbooks, what other companies are seeing, how they decrease AR days or cost to control, things like that. So I think that's just been a consistent message that I heard. And I think clients just need to ask the question, hey, if I was a client, if they're hearing this, it's just like, ask your BFF is a weird term that Epic uses, best friend forever. Okay. So just say, hey, can I talk to my BFF? Or, can I get on the next call with my BFF? And then they can go from there. That's the way I think about it. So.
Yeah, I think the analogy you're searching for is they bought a 50-room house and they're only using 3 of the rooms. And it's like,
exactly. Yes.
Epic saying, hey, you know what? You don't have to live in the kitchen in that one bedroom. You actually purchased a 50-room house. Why don't you go explore the rest of it? And I think the other thing, which you drive home, which is really true, is Epic does a good job of building community. I mean, 10,000 people there, a lot of great presentations from organizations sharing what they've learned, how they've moved the physician experience forward, how they're addressing usability, and they're building run books and playbooks and those kinds of things. Plus, if you develop things, there's ways to share it through their network. And I'm talking as someone who was not an Epic client, and just looking in and saying, "Hey, they've built a very good community of people that share," and that's a strong message.
It is, and I think I've been part of that community so long, I forget how how abnormal that is. I'll say that. I mean, just in this space,
it can be. I was looking at something, and one of the golly kind of things was they talked about or demonstrated voice recognition, doing more command and control kind of stuff within the platform. I know that's futures, but sometimes I like to talk about futures because people are like, really, we're gonna get to a day where the physician's controlling Epic with their voice. Give us a little idea.
Yeah.
I assume that's
yeah. That was one where I rolled my eyes just a second, but I also knew how close Epic is to that just from previous demos at HIMSS, where they demoed this like a year ago, the Epic Voice Assistant, and then working with Nuance to do a lot of that, right? So, and we've been hearing Amazon and other companies send the conversation capturing, if you will. 1 second, can you hear that? My alarm going off. It was like sorry about that.
I did not.
Okay. So, so that was really cool. They did a demonstration basically of a conversation type that a patient and a doctor would have, and how it would not only, you could say, hey, Epic, order amoxicillin. Hey, Epic, can you go ahead and sign this patient up for something? I think some people are calling this digiceuticals, for example. You could say, Epic, can you order the Calm app for this person? Or Epic, things like that. And you could see it kind of load up, order. It would actually put their order in, right? That is that's a place where we've been, that's a holy grail almost. That's pretty cool stuff, right? Yeah. And it will relieve the doctor of having it back to the patient and all those things that we get railed on in Press Ganey, surveys and things like that. The patient say, oh, Dr. Butler was awesome. Then they said, but the computer gets in the way. Well, the computer saved your life a little bit, but I had to kind of look to it, sorry, so, yeah. And so they showed the voice assistant and how they're advancing that. One demo they showed was a very future demo. So I think a lot of folks may have felt like, not a lot of folks, but a couple of them said, oh, that wasn't real. That was vaporware. And Epic did get on stage after that and explain, like, that was future. That's where they were going. But this is live now. Like Epic Voice Assistant, that's live today. So, and I think about a lot of clients are using that. So.
Well, you're on the road heading back, so I've two questions, which will get more into the pragmatic. The first being, talk to us about the conversation around physician burnout and what you heard at the conference, how Epic's addressing that.
Yeah, so physician burnout. Yeah, I'm a big proponent of this one. This is one where I feel like you know all the multifaceted things that go into physician burnout, from feelings of loss of control, just the computer, to more tasks going to the doctor that should go to the nurse. So they did address just briefly some things that can help with physician burnout and what Epic can do versus what I think the clients need to be doing, to be quite honest. And I see Epic is continuing to improve their user interface to make things easier for the doctor. They're also continuing to make the things that the physicians and clients are asking for available and also turned on, meaning that way they're not dependent on, let's say Epic does something and then the client takes the upgrade, but if the client decides don't turn that on because we don't feel like training our doctors, or our doctors may not like it, well, we've already vetted that pretty good up here, at Epic, and so they want those things turned on. And I think a lot of doctors like that concept, and I think a lot of companies do too. And that'll also help them to manage their software, manage all the extra support that they have available a lot easier. So those were some things, and also just like note bloat. Note bloat's a big deal. When you're looking for something in the chart, They showed the tools that were being used, the tools that weren't being used, and they showed some reports that you can ask Epic for. Epic tracks every click inside of its thing. They call it Signal. How do you use your Signal data to focus on those physicians that may need help? Let's say there's after hours called pajama time, and it says, hey, this doctor that has has 2 hours pajama time each night, these are your areas where you want to focus, and here's some little quick e-learning type things that they may want to benefit from. And that's pretty focused type of, that's some pretty focused help, I would say. And these are just out of the box, Epic, it's free. So things like that. So that was pretty cool.
So outside of that, what are your, what were people talking about on the floor? What are some challenges that health systems are having that they're either challenges or things they're excited about that you heard as you sort of walked around in your bell bottoms and whatnot?
Yeah, I think overall the quality of the presentations, it was God knows how many, like 300 or 400. I can't even know. I don't know how many presentations there were, but I think a lot of population health stuff. Also a lot of new clients came on. That they were switching from Cerner, Allscripts, or whatever. So they always have that kind of floating through to show all the new clients welcoming them. And so they were in the audience. So there were just different generations of Epic clients in the audience, and having Epic to figure out, or having them figure out what is relevant to them right now in their maturity in this thing, right? So I felt like that there was a positive vibe as far as that everybody could find what they needed where they were. If they were getting ready to install, if they were post-live, there was things that were being presented that they could sit in on and network, meet a CMIO from this hospital, get their number, set up a WebEx later on with them to see how do they do this or that. So I think just in general that just pushing together all the Epic clients and making it so that they have a venue, a forum where it's open, it's free, it's fun. I mean, it's fun and flowing. And so I think that was just the vibe that I got, but that's kind of every year. There was no one topic that was really hot, I didn't think, that was on the floor because, of course, APIs, App Orchard, that's always hot, right? That's going to be the thing. But I find that 90% of clients don't care about that right now because they're trying to just get their doctors to get CHF, heart failure, and some of those quality measures with the tools they have. So that's what my take on it.
It's interesting. I refer to it as a conference every now and then, and it's not really a conference. It is a user group meeting, and they are very different animals. A user group meeting is really around getting the most out of the tools that you have and connecting your users in a way that they can collaborate and talk, and that's what Epic does a really good job of, and that's why it feels a little different than a conference. Although it looked like it was a lot of fun. Did you go on the merry-go-round and other things up there?
Yeah. You know what? I grew up in a small town. We had something called the Reasons Fair. I was in Texas, Reasons Fair every summer. We were there, and I went ahead and did the merry-go-round. I had to say that. I think I went ahead and posted that too. I'm growing into my own now. I got on the merry-go-round. I said it. It came out. Just don't tell my brother.
The last thing, and Twitter has a couple people talking about this. So Judy made some comments about the ONC CMS type, the interoperability and the 21st Century Cures Act and whatnot. What's the general feeling around that? Is there a lot of conversation around it, or is it like you're saying, which is, a lot of health systems are, just trying to just get the basic blocking and tackling down, and this is something for the heavyweights to really weigh in on?
I think in general, what the clients are saying, the folks that are here that came to the conference, that's not on their radar. The ONC and all the alphabet soup, the government will do whatever, right? That's cool. But I think more importantly, what the gist is that Epic gave the message to say, look, if we're gonna start sending out all this patient data, right, to everybody, any app that wants it, it feels like, and I feel the same way, and that these app companies that have, whether it's freeware, shareware, egoware, what is their accountability to that patient data? And it's as simple as that. And now Epic is, they're like, look, their only skin in the game is to say, before you put a spigot in here and just spill out all this patient data, does the patient really understand what that means? and I for one, I don't want any app taking my data that I don't feel that I don't really know all the fine print, and especially if I know that when I go to another place, I got something like Share Everywhere or whatever, and they can know what's going on with me and provide the care. And so I don't know. I think that's as simple as I heard it. And of course, it gets very difficult in the fire and all the other things like that some of the companies are really want to be innovative, and they're very innovative in that space. And I can see the benefits of it truly. But I think for this conference and for right now in healthcare in 2019, right now, where what I heard this past week, Epic saying, okay, the ONC is going to come out. They're going to ask us to start doing a lot more things because, the big dog's on the block. So, but that was the kind of conversation about it. And but I think it was more like just saying, like, this is from our perspective, what it means to us and what it should mean to you as far as how your data is shared, who is it shared with, how is it used, things like that, and yeah, so.
Absolutely. Well, David, thanks for taking the time to pull over to the side of the road to have this conversation.
Yeah, no. Thanks for asking me for my opinion. Always willing to help. So hope it made sense. That's just, and once again, that's just Dave Butler, my opinion.
Is there any way that people can follow you or get a hold of you or?
Oh, definitely. Yeah, definitely. I'm at Twitter at David Butler MD. On Twitter, I'm on LinkedIn. Look me up, follow me. I'm definitely always posting something weird or goofy that deals with medical informatics, IT, healthcare. I try to keep it witty, keep it fun, and not troll too bad. But there you go. Yeah.
All right, sounds good. I want to thank David for joining us, and hope he has a safe travels back. He actually pulled over to a Starbucks on the side of the road to have that conversation. I really appreciate him doing that. Please come back every Friday for more great interviews with influencers. And don't forget, every Tuesday, we take a look at the news, which is impacting health IT. This show is a production of This Week in Health IT. For more great content, you can check out the website, thisweekhealth.com, or the YouTube channel, thisweekhealth.com, and just go ahead and click on one of the links up top. Thanks for listening. That's all for now.